Hello friends, today I am discussing about PRBC, FFP and platelets and when we use these blood component in which cases. So first of all we are discussing about blood and its component. So in whole blood we have RBC, WBC, platelets and plasma. And PRBCs means packed cell blood cells. In PRBCs, it contains RBCs. RBCs separated from platelets and plasma. So whole blood contains RBC, WBC, platelets and plasma. If we remove plasma, platelets and WBC, so remaining product is packed red blood cells means PRBCs. Another components of blood is platelets and remaining components is plasma. Okay. So here in whole blood we have 55% of whole blood is plasma and plasma content water, ions, proteins, nutrients, wastes and gases. So this form a plasma and 1% of whole blood contain WBC. WBC means white blood cells and platelets. So platelets and white blood cells 1% of whole blood. Okay, and remaining 44% of whole blood is RBCs. RBCs mean red blood cells. Okay, so 55% of whole blood is plasma and 1% of whole blood is WBC plus platelets and remaining 44% is RBCs. Okay, so firstly we are discussing about PRBC. PRBC full form is packed red blood cell. Okay, so in this figure we are seeing that packed red blood cell. Okay, so it contains RBCs. And what is the function of PRBCs? The function of PRBCs is carry oxygen to tissue. Why it carry oxygen to tissue? So RBC contain hemoglobin and hemoglobin bind 4 oxygen molecule. Okay, the 4 oxygen molecule binds with the one hemoglobin molecule. Okay, so RBC carry oxygen to tissue. Okay, so main function is carry oxygen to tissue. So indications where we use these PRBC. Okay, where in case of anemia we use PRBC. What is the meaning of anemia? Anemia means a RBC's level decrease in blood, that's known as the anemia. Okay, we are seeing this figure, this is the normal case or this is the anemia case. So in normal case RBCs are adequate, but in anemia case RBCs number or quantities decreases. Okay, so this is the case of anemia. So in anemia case we are use RPRBCs. Okay, and also in case of blood loss and surgery and trauma. And what is the dose of PRBC? Generally it's 1 to 2 units, approx 250 to 600 ml. This is the general dose of PRBC. Okay, and shelf life is 21 to 35 days. What's the meaning of shelf life? Shelf life means length of time a product remains usable and retain its quality. That's called the shelf life. Okay, and next FFP. FFP means fresh frozen plasma. So fresh frozen plasma, it contains plasma with clotting factor. So what is the function of FFP? The function is supports blood clotting. Okay, and bleeding disorders like as hemophilia we use in case of hemophilia and some liver disease and coagulopathy and massive transfusion. In this case we use FFP and FFP contain plasma with clotting factor. Okay, and the general dose is 1 to 2 units, that's contain 200 ml to 500 ml. The shelf life is 1 year if it is frozen. Okay, next is platelets. So platelets contains platelets. Okay, if from whole blood we remove plasma, WBC and RBC, then the remaining product is platelets. So what is the function of platelets? It support blood clotting. So the function of platelets is clot the blood. So due to the platelets, it stop the bleeding. Okay. So platelets accumulate where trauma or a blood vessels rupture. Okay. That side these platelets accumulate and stop the bleeding. Okay. Indication is bleeding disorder. Used in case of bleeding disorder like as thrombocytopenia. What is the meaning of the thrombocytopenia? It contains the three terms. One is thrombo, second is cyto, and third is penia. Penia means a less, okay, or a decrease. Thrombo means a thrombus due to the platelets. So platelets and cyto means a cell. So platelets is the cell and penia means a decrease. So if platelets amount is decreases, then this term is known as the thrombocytopenia. So in case of thrombocytopenia, we use platelets, and also in case of surgery, trauma, or a cancer treatment, the dose is 1 to 2 unit, 200 to 400 ml, and the shelf life is 5 to 7 days. Note, typically 1 to 2 units of each component are transfused over 30 minutes to 2 hours. Okay, and the transfusion rate and volume may be adjusted based on the patient response and medical condition. So the transfusion rate or a dose like 1 to 2 unit, 1 to 3 unit depend on the situation of the patient, and the rate of transfusion also depend on the situation of patient. Okay, thank you.